main window to start. We have to insert the date of our patients in order to connect the scanner and to follow the steps. So this is a account to access our database. So this is how this company operates. Not all companies operate in the same way, but anyhow. So this is how this operates. So we introduce the ID and the password. And so the soft opens. And they show us the updates. Now I shall close this menu. Also the help menu. So this is the main page. So in dashboard, we have the general informations about the scanner and about the cases that we have scanned so far. So in the right side, you see the accepted cases accepted by the lab, the cases shipped back from the lab, and the completed cases that we finalized in the patient's mouth. This is the memory, cloud storage, as you see. This memory will be filled up, and the STL type files, because this STL extension files, we'll have to save them in the memory of our own computer after a while when that memory fills up. In the casebox menu, we see the cases that we already scanned of our patients. A scan starts with the calibration. This is, we can do it every day, but not more than 1 week. A scanner has to be calibrated. So at least once a week you have to calibrate your scanner. And this is for this we have a special device, as you see in the picture on the left side. So this tip is removed, and instead of it, this calibration device is mounted after we remove the end tab. So this is the calibration device. Now I shall apply it in position 1, and I will wait for instructions now. I'll have to press the start button of the LED of the scanner and next. Now in this moment the scanner receives the information from the calibration device, and now I switch it to position number 2. And then we continue to calibrate the scanner step by step. Now we are at the last position of the calibration device. The scanner has started doing its own calibration, which is done. So this is a very important step in order to have an impression as perfect as possible. You see, it doesn't take long, it's easy to do. And now we're sure that the scanner works at optimal parameters. So I press the new case button, new patient. We have to introduce the name of the patient, and then we press register and scan. Now this menu or this window, we have the dental arches, and we will have to give the information about the type of crown or crowns or bridges or whatever we want to do in case of our patients. So let us choose, for example, the two upper central incisors and veneers. Let's say we do it in lithium disilicate, color A1, and let's say we want to do something on the laterals as well. Crowns, for example, anatomic crowns, that's full anatomic crowns, zirconia crowns, same color. The second upper premolar from the first quadrant will, let's say it's missing, so it will be a pontic, right? So it's gonna be a bridge between 1,4 and 1,6. Let's take an example in the second quadrant, 3 crowns. Let's say we'll do crowns on implants. So we choose a screw-retained, implant supported zirconia crowns, same color A1. You see that for each of these situations the color is different, so that we can easily visualize what we have chosen as material, what we selected from the menu. Now we save those choices and we can start scanning. This is the very scanning of the case. So once we press scan, there's another page that pops up, and on the upper side we have more options. The menu for the maxilla, the menu for the mandible, and the menu to scan the occlusion. And at the same time you see that right next after the maxilla is we have this menu to scan the transfer abutments, the scan bodies as they are called. And this popped up here because in the second quadrant, you remember, we have chosen to do an implant retained, a number of implant retained crowns. So now we press the button for the management of the scanning protocol. So we can scan the face, we can scan pre-op, so how the teeth were looking before we trimmed them, we milled them. Yeah, the doctor did the preparation, so before the preparation. So for this scan, I don't want to register with scan bodies. For the implants, I can remove this option, and that's it. So I say OK now. So the strategy is now only maxilla, mandible, and bite, because we have chosen, just for an example, not to scan the implants. So let's start scanning the maxillary now. I pressed the button. Always the tip of the scanner is mounted in such a way so as to have easy access to the button to the start button. And now I'll start to scan the maxillary. And you see the scanning is done from the occlusal surface. Now I stop the scanning a little bit to reduce the volume of the scanner. So the melody of the scanner the sound of the scanner will be at a higher level when the scanner finds itself, and when the scanner loses its location and doesn't record properly the data, then the sound decreases in volume. So when it doesn't sing loud, it means that the scanner is not happy. That's the idea. It's an indicator of the fact that the scanner does or does not record properly the data, or finds itself on the surface of the teeth that it registers. So if the scanner doesn't find the position on the arch, we'll have to come back to a point that the scanner can recognize that it already scanned. So there are some advices you see in the upper left. There are some advices how to scan, how to get a better scan. You see, occlusal surface and suprasingular first, and then the lateral sides. So now the scanner is singing, so to say, does the noise, the specific noise. So we start with the teeth on the lateral region first, the occlusal side, as we said. So we continue to the front, towards the front. And here we can do some sort of rock and roll movement. And you see, it was a moment when the scanner was lost, so we had to come back in a position that the scanner could recognize. So this rock and roll movement between the labial and palatal is necessary because we record teeth that have an incisal edge, and in order for the scanner to be able to correctly do the superposition of the two faces in relation to the incisal edge, we needed to do this rolling from one side to the other. Once we are done with the occlusal surface of the teeth, at a 45-degree angle, I will start to get additional data. I will get on the palatal aspects of the teeth, and then of course the labial. So the palatal, you see, I do the same for the opposing arch, the one we started with. And now I cross on the other side to the labial. The scanner has to see clearly one surface that it already scanned and has in its memory, and another surface of the teeth that is to be scanned at that very moment. Yeah. So to be able to position the surfaces one in correct relation to the other. So I go back to the first quadrant. So when the scanner doesn't find itself, I come back to the occlusal surface. That is has a very sharp relief, so it's easier for the scanner to recognize. And then I scan the labial, and you see interproximals are also very important to be scanned. And I'll try to add data wherever I consider is necessary, whenever I see on the monitor. Ideally, for the easiest way to scan is when the doctor looks at the screen of the computer, you see that we see the region that we're scanning. We see it in the green square, but we also see it down right. So we can see what the scanner is seeing. That's the idea. And so we'll be able to position ourselves as well as possible every time. You see there's still some portions lacking. Now the operator pressed the stop button, and on the monitor I will see the zones, the regions marked in blue, where the scanner says go ahead and scan again. And this is exactly what the operator is doing now. Now just to pause in, now let's pause in for a while and mention that what we see here is a scanning of an arch with good teeth and not unprepared teeth, right? So this is not the case normally. Normally you have the preparations, you have the image of the abutments on your screen, right? The prepared teeth, yeah, the one that have been milled by the dentist. But this is just a demonstration, right? So it's also important not to insist too much, because if I insist too much, I will not have the right superposition of all the supplementary data that I bring in. So if I scan many times, it will be the phenomenon called layering. The layers will be one over the other, and of course this is false. So the zones that are more difficult to scan are around the molars and interdental zones, and it is obvious that the smaller the recording head of the scanner, the intraoral piece of the scanner, the better, theoretically, the better will be the scanning, because you can get into areas, into zones where if your scanner is big, you simply can't get. So once we recorded the details from the maxillary, we'll have to scan the mandible, and for this I'll go to the other menu to scan the mandible. I will change obviously the tip of the scanner so as to be able to record the mandible. So I switch it to the other side, downside, yeah. And now the software optimizes the maxillary scan. So now I start with the mandible. I start scanning the mandible, the occlusal surface of the lateral teeth, and I go to the front teeth. The front teeth that I will scan in the same way, doing this rock and roll movement between labial and oral surfaces of the teeth. You see how in this zone the lip of the patient, so to say, has been recorded, and the scanner is able to make the difference. If you teach the scanner to understand this, many scanners already now have artificial intelligence. They know what to scan and what to remove from the scan. And even they know what not to scan at all. Yeah, this is a slightly older scanner. Modern scanners do the job faster and better. So I have to fix the image on already scanned surfaces. So we keep going on the front now. We come back to the front. On the front we do this rock and roll movement. So as to record as many details as possible. And then I continue at a around 45-degree angle on the laterals. And when the scanner doesn't find the position anymore, I will come back to the occlusive surface or surfaces that the scanner already scanned. So the scanner will be able to combine the informations so as to have a continuous flux of data that we are recording. Labial aspects and yes, interdental surfaces that are very important. And now we shall stop the scanner, and in the same way the scanner will show us where we have to insist in order to get better details of the respective zones. We always dry the teeth and the gums so that data acquisition can be as exact as possible. And in some cases we can use some devices to move the soft tissues aside. We're always recording part of the tooth that has already been scanned. We mentioned that already before. Regions that the scanner knows and that are familiar because it already scanned them. This is very important for the superposition that the software is going to do between various data acquired during various passages. So when I think this is the maximum that I can get, I can start the occlusion. So let's see the third menu, the occlusion menu. So let's find the relationship between the maxillary and the mandible. We'll do it on 1 and 4 quadrants and 2 or 3 quadrants to be able to align the two arches as well as possible. So you see, we start in the lower part of the screen. We first have to record the data on the right side. So I try to record as well as possible, get as many details as possible. And now the scanner kind of understood how the two models sit in relationship to each other. So the scanner was able to combine the two, and now we have to confirm, is this right or not? So we press the button to scan the left side. So the operator is doing the same movements. And yes, the scanner said, okay, yes, that's right. Now I know how the arches are related to each other. So the two models are now positioned in occlusion, and the scanner is optimizing the data. We'll have to wait to get the functional impressions, so to say, the final impressions. and the optimizing of the bite, which is very important. Optimizing means all the details that are remodeled in the software by the software after scanning. Of course, we can remove informations that we don't need, like those margins of the models, or whatever. This is on the left side. We have a trimming option, and there we can remove those parts that have been scanned and we don't need them, because we don't need to send big data to the lab, right? Useless big data. So now we wait for the optimizing of the models, and we shall see the trimming afterwards. So we position the models, we press the trimming button, and as you can see, we remove it just by placing a line around. Freehand trimming. You just press the left button of the mouse, and I remove the sections that I don't like. And to confirm the delete, I press the right button, right click. Same for the palatal of the model. I select what I don't need. I can move the model for sure on the screen. So to facilitate the operations, the sectioning, so to say, cleaning of the model, actually, that's what we're doing. And yes, that's fairly nice to be sent to the lab. Same thing we can do in the case of the mandible, obviously. After the optimization, for sure, right? So the same for the mandible. We select the zones, freehand selection. We can use this brush, this device to erase, like a erasing brush. We can easily mark the zones that we want to delete. There is also this option, the quick trimming option. We don't want to delete everything. The quick trimming is for something that is separated from the model. And just click on that and it deletes the zone. But the zones that are really apart from the model. For example, this one, the third option, as you saw, it was separated from the model. Then you can delete it just by clicking on it. Because all these zones obviously are of no interest for the dental technician, for the teeth that have to be created. So now I will see shortly the occlusion between the two after the information has been optimized. So now it's clean, in occlusion. I see the occlusion relationship on both left and right side. The last thing we have to do is to process the data in order to be sent to the dental lab, where they will import it in the computer-assisted design software.